Thanks for staying with us. So once in a while, when we come across amazing women, we have to bring them on the show to feature them, just to show the amazing work women are doing. So joining us now is a distinguished robotics and embedded system engineer with over 11 years of exceptional tech expertise, the founder of Nextwear. And also, her name is Kemisola Bolarinwa. She's also a distinguished robotics and embedded system engineer. Through her Nextwear Technologies, Kemisola designs and develops innovative technology, one close to body, addressing health-related challenges while seemingly blending fashion and safety. Welcome with us as she joins us from her Abuja studio. Welcome, Kemisola.
Thank you.
Good to have you. So we see all the amazing work you're doing in robotics. Tell us, how did you come about getting into robotics?
Oh, well, I actually have a background in engineering. I've always been an innovative person. I'm driven by innovation when you talk about STEM, science, technology, engineering, mathematics. So it's a passion that I've built right from my secondary school days, college days. So after I finished from college, I moved to study electrical electronics from my first degree. So after the first degree, I have to move forward and exploit more. So that was how I came about robotics, and I, go into robotics and embedded system.
Wow. So I was really shocked to realize you had so many amazing awards. But I have to ask you, first of all, where's your first degree from? Is it Nigeria or abroad?
Oh, Nigeria.
First degree, exactly.
From my hometown.
Exactly.
Yeah, in Nigeria, University of Ado-Ekiti.
Wow. Nice. Because we always have a theory that many Nigerians who are doing amazing work, usually many of them have their first degrees here from Nigeria, but that's just by the way. So tell us about that. Well, let YK jump in.
I ask about the smart bra. I mean, that sounds like really, really amazing, and I would love to
have one. Tell us about the smart bra. What's that about?
Okay. The smart bra idea came in 2019, and it's as a result of I lost someone close, my auntie actually. I lost my auntie to breast cancer in 2017. So there, I was with her, taking care of her while she was at teaching hospital, Ibadan. So I could see that other women are also, going through this kind of disease, because that was the first time of me hearing that disease, breast cancer. I've never had it before. So seeing women like myself, even young women too, groaning in pains of breast cancer gave me a concern. So when I now venture into wearable technologies, where I'm working right now, that was the first thing that came to my mind, that I need to look for a solution, a very, comfortable, smart solution that can help with early detection. So I went into research, and my research let me know that I realized that if you're able to detect at early stage, you have the chances of getting cured. And the problem here, using Nigeria as a case study right now, the problem is the screening technologies, the screening machines are not closer to the people. Women cannot really access those screening machines. You have to travel miles before you access mammogram. Let me use the typical one now, mammograms. Mammogram, you have to travel, from one state to another state for you to access mammograms. And it's not even something women can, can go for. Some women, they tell them once in a year. Some even once in 2 years before you could diagnose yourself with mammograms. And even aside that, it has age limitation. So if you're not 45 or 50, you cannot use mammograms. That is how ethic it is. So that made me go into research and see how I can change that perspective of early detection, and that brought about the bra. It's a smart bra in form of a cup. It's a form of a cup that women will put on. You put on the cup, it diagnoses you, and you see the result on your mobile or web application in form of image. So when you see the image, another technology is there that will transmit, that will translate the image for you. So you don't need to get a physician, you don't need a doctor to interpret the image. So you have another technology that will interpret the image. So that is just how it works. So easy to use.
So how accurate is this? Let's do a comparison. So I'm not 45 and I had to do breast examination at some point. They use something like an infra, something light to check around the breast. So is it at that stage that the breast, the smart bra works, or at a mammogram's efficiency stage?
Okay, it works at that early stage. It's just like other normal devices like a glucometer. You know, people now have glucometer in their houses. You have a BP monitoring machine in your houses. So same thing with the bra. So you have it in the house every morning, or you might decide to have it done maybe twice in a week. You get the device, you put it on, get to know your breast health. That is just the scenario. Know your breast health. So you get the device, wear it, where you see your breast health, if it's okay or if it's not okay, you know. And when the device you diagnose yourself and there's an abnormality in the breast, immediately the device will advise you to go for proper screening. So you have to go to the hospital for proper screening, for proper diagnosis, yes.
Yes, so I can see that your passion and commitment to advancing technology is geared towards gender equality. Can you please expatiate on that? Thank you.
Well, you know, as a female engineer and, you know, looking at my the challenges I faced, actually, my challenges when I got into the real world. When I was in college, during my college days, I attended a girls' school, so I never know the real world is biased. So by the time I entered university, and I could see how the things were going, finding yourself in a male-dominated field, engineering, the bias is there. In some situation, some occasion, you might even try to, maybe a question was thrown into the class and you're trying to attempt the question, the bias is there. No, they rather call the guys, or probably during practicals, even the guys who say, don't worry, we'll do it for you, the bias. And when I graduated and trying to get a job, with my colleagues then, we started writing applications, and I realized that being a female engineer, because it's my passion, I want to practice as an engineer, but I wasn't given the opportunity. And I believe it was based on my gender, and that was why I actually took that personally. I took it personally to advocate for that bridge.
So this invention
is around bridging that gap between, in STEM generally. So we have like an equity in STEM.
Mm. Okay, so I mean, one of the reasons why we like to bring people like you on our show is just to show the amazing work women are doing out there. This invention, this smart bra, is it yet in the market? Are you still trying to get approvals for it? Is it in Nigeria? Is it abroad? How do people have access to it?
Okay, we are still developing. The first prototype was here in 2021, and ever since we got so many feedback from professionals, health professionals, even technology professionals, giving us some ideas on how we could advance the technology. So we've been on that since 2021. No, it's an invention, it's something that we've not done before. So we need to step back and do more of R&D, research and development. So all through 2021 to this stage, we've came up with about 3 prototypes, working prototypes. So currently now, I can remember then we were not working with imaging. Our results are not coming out with image. But after we advanced technology, currently we are getting image. So we are still at the R&D stage, and we've completed that. So what we want to do right now is to go into the clinical trial stage. After the clinical trial, with the protocol, we have having it done with 2,000 women. So after that, we go into the regulatory section where we're going to get approval and certification from relevant authorities. So from there, we can launch our MVP.
Oh, this approval, is it within Nigeria or it's outside Nigeria?
Well, I'm a Nigerian, and what brought about the whole idea is my community, the people around me, what is happening around me. So the deployment is going to be in Nigeria first. Okay. So it's going to be deployed in Nigeria. Fantastic. So after Nigeria, we can now move to other African countries, because we realize that the problem is actually fixing the the less underserved community.
Yeah.
You know, they are the one really facing this too, because they don't really have access to all the screening technologies. So that is why we want to like start from Nigeria, then move to other African countries before we can now
You've given me hope.
take it to other Western world.
You've given me hope because innovative discoveries like this are usually expensive when they finally get patented and distributed outside. So you're saying that it will be made affordable to the women.
That's good. Well, we have to wrap up with you, Kemisola, but we thank you for coming on the show because one of the reasons, as I said, when we heard your story, we thought it was an amazing story to give you our platform to share. And hopefully once you have the approvals, we can also help you to project and help you to make some sales. And we'll be happy to push it out internationally.
Yes, so please, let's be the first to buy. We want to buy.
Congratulations. Any final words? Any final words to us?
Thank you so much.
Any final words? Go ahead.
Well, I would say that the fight against cancer, generally, not just breast cancer, it's our work. You know, it's everybody's work, it's everybody's job to fight against, cancer. And for women, regular checkup, like, breast self-examination is very important, standing in front of the mirror. I know we've all neglected that, and so even some women doesn't even know how to do that, but I think we should go on the internet or visit our doctors to teach us on how to do that breast self-examination, because the rate of breast cancer, it's increasing currently now in Nigeria, because now I'm an advocate and I visit some health facility to see women having that. So it's on the eye side, even among the young women. So my advice is for all women out there is to check their breast health often, regularly. Thank you.
Thank you so much. It was a pleasure having you on the show. Let's go on a short break now. When we come back, we continue with the show. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.